Welcome back to the Elevate Pain-Free program. I'm Dr. Connor Oliveri, and in this module, we are tackling one of the most common complaints I see in my practice, chronic neck pain. Whether your pain is from sitting at a desk all day, looking down at your phone, or waking up with stiffness every morning, I want you to know that what you are about to learn will make a real difference. By the end of this module, you will have a complete neck pain relief protocol you can do anywhere in 10 minutes or less. Let's start with the number one cause of neck pain that nobody talks about: forward head posture. For every inch your head sits forward of your shoulders, your neck is carrying an extra 10 pounds of load. Most people I see in practice have their head 2 to 3 inches forward of where it should be. That means their neck is carrying 20 to 30 extra pounds of pressure every single hour of every single day. Over time, this compresses the cervical discs, irritates the facet joints, and strains the muscles at the base of the skull, creating the exact tension headaches, neck stiffness, and shoulder pain that brought you to this program. The solution is not to just try to stand up straight. That never works long term because the underlying muscle imbalances are still there. We need to release the tight muscles that are pulling your head forward and activate the deep muscles that hold your head in the correct position. That is exactly what this protocol does. Exercise number 1 is the chin tuck. This is the single most important exercise for neck pain, and I want you to do it every single day. Sit or stand tall. Without tilting your head up or down, gently slide your head straight back as if you are trying to make a double chin. You should feel a gentle stretch at the base of your skull. Hold for 5 seconds, release, repeat 10 times. This exercise activates the deep cervical flexors, the small muscles at the front of your neck that are almost always weak in people with neck pain, and simultaneously stretches the suboccipital muscles at the base of your skull that are almost always too tight. Do 3 sets of 10 repetitions every single day. Exercise number 2 is the upper trapezius stretch. The upper trapezius is the large muscle that runs from the base of your skull down to your shoulder. It is almost universally tight in people with neck pain and tension headaches. Sit tall in a chair. Reach your right hand under the chair and hold on. This anchors your shoulder down. Now slowly tilt your left ear toward your left shoulder until you feel a gentle stretch on the right side of your neck. Hold for 30 seconds. Breathe deeply. Repeat on the other side. Do this twice on each side daily. Exercise number 3 is the levator scapulae stretch. The levator scapulae runs from the upper cervical vertebrae down to the top of your shoulder blade. When this muscle is tight, it creates that deep aching pain between your neck and your shoulder that feels impossible to release. Sit tall. Rotate your head 45 degrees to the left. Now tuck your chin down toward your left armpit. Use your left hand to gently add a little more stretch. You should feel this deep in the right side of your neck and down into your shoulder blade area. Hold for 30 seconds. Repeat on the other side. Do this twice each side daily. Exercise number 4 is the thoracic extension stretch. This one surprises people because it targets the mid-back, not the neck. But here is why it matters. When your mid-back is stiff and rounded, your neck has to compensate by extending backward to keep your eyes level with the horizon. This compensation creates chronic compression in the lower cervical spine. Interlace your fingers behind your head. Gently arch your upper back backward over your hands, opening the front of your chest toward the ceiling. Hold for 10 seconds. Repeat 5 times. You may hear some gentle popping. That is completely normal and actually a sign that movement is being restored to stiff joints. Exercise number 5 is the doorway chest stretch. Tight pectoral muscles pull your shoulders forward and your head forward with them. Stand in a doorway with your arms at 90 degrees against the frame. Gently lean your body forward until you feel a stretch across your chest and the front of your shoulders. Hold for 30 seconds. Repeat twice daily. Within 2 weeks of doing this stretch consistently, you will notice your shoulders naturally sitting further back. And your neck pain will reduce significantly as a result. Your neck pain protocol is 5 exercises: chin tucks, upper trapezius stretch, levator scapulae stretch, thoracic extension, and doorway chest stretch. Total time, 10 minutes. Do this every single day. Some days you will feel tight and restricted. Do it anyway. Some days you will feel good. Do it anyway. Consistency is everything. I will see you in Module 3 where we tackle mid-back pain. Keep going. You are doing great.